My favorite part of a live is the first couple of minutes. Just wait for a couple of minutes for everybody to come on. So, hi everyone. Good to meet you. Good to see you. If it's your first time tuning in, appreciate it. This is going to be a Q&A for COVID-19, and I'll go ahead and start introducing myself, and people will be joining in a minute. My name is Lina Abujamra, and I am running both a Facebook camera and an Instagram camera. So if I switch eyes, that's why, just to give you some context. Anyway, I'm a pediatric emergency room doctor by training. I've spent about 18 years in the ER in Chicago, and the last 2 years I've been working full-time in telemedicine. I work for a company and I cover a number of states, almost half of the states in the United States. And so in the last few days, as the COVID crisis has grown and the pandemic has become very familiar to many of you, I have become very familiar to talking about COVID as a first responder to people who have a ton of questions about it. And so a week ago, we did our first Facebook Live where it was an impromptu. I just felt like, hey, let's come on and talk about the symptoms. And a week later, this was 1 week ago, and a week later, many of you are very familiar now with COVID, and you've watched the news and your lives have been affected by it. And somebody texted me yesterday, a dear friend of mine, and said, hey, why don't you do a Q&A? And I think it's a great idea. I don't think there's enough correct information out there. There's a lot of questions out there. And so the spirit of this live is to answer some questions that you might have. At the end of the day, I spend every day of my life answering the type of questions that have come up. I've asked you to send the questions ahead of time, and you have. So I'll also, I guess, a little footnote. I am not a virologist. I'm not an epidemiologist. I am not an infectious disease specialist. I am ER trained. I am a first responder, and I am the person now who helps people decide what to do, where to go, how to handle their illness, and really help manage the majority of the population. Because remember, the majority of the population is not ending up in the hospital, is not dying. And so we're going to kind of go over some of that. I'm going to spend about 10 minutes. I've looked at your questions, and I'm going to do a little bit of an overview and then go down and hone in on the questions and take questions that you have that maybe I haven't covered yet. So that's the plan. I don't know how long we'll go, but definitely not more than an hour. I know the last one was long, but many of you watched the whole thing, and I've got great feedback on it, and I appreciate it. But let me remind you of this. I think we need to start with this. We did not know what COVID was. Really, the average person had not heard about it until December sometime, when we started hearing about cases in China. In fact, the first death in China happened on January 11. We are March 20. I think it's really, really important that we keep these dates in our minds. The first case in the United States was in Washington. A young 35-year-old was diagnosed on, get this, January 20. Okay? The first death in the United States of COVID, February 29. I think this timeline is critical. February 29 is the first death. Today, March 20, we have in the United States, I think as of today, the world meter lists 19,382 cases in the US, 256 deaths. Worldwide, 246,000 cases, over 10,000 deaths. The Italian numbers are crazy. I think that's really what sort of shook everybody up, is once Italy shut down. Last Friday, I was in Florida, flew here, and still people were just talking about this. Now we are a week later, and everything has changed. And I think this is really why all of us are reeling, because life has changed for all of us. As of today, Chicago's going on lockdown. I think 5 o'clock it started, the lockdown in Chicago, which just means you got to stay home. And they had to do this because people were not doing it. And so a couple of days ago, we saw people in Miami hanging out on the beaches, despite the growing numbers and the fears that people had. And so really one thing that keeps coming up is people are wondering, and somebody asked that question, which is, are we making much about nothing? And I think anybody who's watching the news by now should sort of get a sense that no, we're not, that there's a reason for the fear. And I think you've, and a reason for the concern, and a reason for the social isolation, and the reason for the school closures and the business shutdowns. And the biggest reason, and somebody asked this question, is this virus, remind us, why is this different than anything else? And so I saw a little graph, I think in Vox. I did a little research this afternoon, and just comparing flu to COVID, to the coronavirus. And this is just a very rough, again, layperson's way of looking at it. Just to put in perspective, influenza, which we're all familiar with, many of us have had, we get the flu test for. So flu versus COVID. Infectivity, the flu 1.3. If you have it, you give it to 1.3 people. COVID, 2 to 2.5 people get it from you. Incubation period. The flu, your incubation period, you can give it to somebody in a context of 1 to 4 days. COVID, you've got 1 to 14 days. So you have this 2 weeks where you're walking around potentially infective. So that is a lot of people. Now you're infecting 2 to 2.5 people in a longer period of time. So now you see the dramatic numbers that can blow up by just being around other people and not knowing you have the virus. So the flu already is very contagious. We all used to fear the flu. I mean, we talked about flu shots and repeating flu shots. And so it's a big deal, the flu. Now we've got 14 days as opposed to 4 and 2.5 times the infectivity. Here's another flu versus COVID. Hospitalizations. The flu, 2% of people get hospitalized. COVID, 19%. 2 versus 19. Here's another fatality rate. The flu, less than 0.1%. COVID, 1 to 3.5%. Now, one issue comes up, and I think you got to take these numbers in stride, okay? I told you guys last week, we talked about this, everybody's talking about this, but it's worth repeating. We saw, I mean, last week the numbers were low in the US, and we talked about the fact that don't be alarmed that in the next 2 weeks, as testing expands, we will see a hugely increasing number of cases. We haven't even begun to see, I think, how many we will continue to see, because we're a big country. We've got millions of people in the US. And so as we test more and more, I think, I read somewhere, and I don't know exact numbers on testing, but they're doing about 25,000 tests in the United States daily. That's going to add up, and they're increasing testing today compared to a week ago. Much more testing. Still probably not enough. Differing opinions on, we'll get to that in a minute. Should we test everybody? Should we not? We'll get to that in a second. But still, the fact is, if you're looking at rates and numbers and you're not testing everybody, then the death rates might be skewed. Remember that you could have hundreds of thousands of people who have it. We don't know, tens of thousands. But you're looking at only the positives and now looking at the death rates. And so your statistics can be skewed. This is a 3-week process of disease, which I think is really relevant in light of so many questions that I've received today. I opened up the Facebook status and said, hey, we're going to be doing a Q&A, ask your questions. And people did. And it's fascinating to me because we are an Amazon culture prime, Amazon Prime in every way, including diseases like this and pandemics. We have no room for perspective anymore. And I'm guilty of the same. It's like 2 days pass and you're going, what? They haven't tested everybody? They haven't gotten a solution yet? How do they not have a vaccine? And yet 3 weeks into this globally, and got questions about all sorts of science, that we'll come to in a minute, about the ibuprofen theories and the steroids and the blood types and the anti-malarial medicines. And researchers think about it, and they've barely come up with a title for the paper that they want to write, right? I mean, like, we're so rushed and we're losing perspective of the timelines. Now, of course, why? Because people can die. So it's an understandable fear and pressure, but I think we need to sort of scale back a minute and sort of put things in perspective. And one of the reasons that the pressure feels so great is because it's impacting our lives, and we're not used to this. This is the first time we're dealing with this. And so I sort of want to, kind of talked about numbers, gave you a little perspective. I want to just run through. We talked a little bit about the comparison, why it's a big deal still, numbers in the US. Let's talk about symptoms. I still had some questions about symptoms. The big 3, the trifecta now: fever, cough, and shortness of breath. All right. Everybody now feels short of breath. I get calls. So I work for this company that is now, we are the first respondents pretty much. So patients are told, patients don't need to be told. Everybody who's sick is like, I am not going to the hospital. Understood. I wouldn't want to go either. In fact, if you go to the hospital, you're going to be met by somebody outside of the hospital who's going to measure your temperature, and you're going to get a little bit of history. And if you have factors that look like fever, cough, and shortness of breath, you're going to be asked to go to your car, and you're going to call the hotline that the hospital has. I mean, a lot of hospitals have different systems, but in essence, the same. And then they're going to, if you are in fact a person under supervision, a person under investigation, they're going to move you to, they're going to send you to the ER, where now most of the United States within the course of a week have adjusted. They've gone into disaster modes. They've got tents, hospitals outside of the hospital that they've built to accommodate people who are infectious. And so they're staffed by doctors and nurses and the allied, the techs and all of the people that it takes to run an ER. And they are all in protective gear. They have shorter shifts because this protective gear is very hot, very exhausting, and they're the ones who are managing those people who qualify to be in the hospital. The majority of people who have what we would call flu-like, let's use that term loosely, symptoms, who might not have a fever, are not being taken to the ER. So when you go through the conversation with the hotline, quickly you're being identified as a person who might not be at risk, but might have the disease. And so you're told to go home and call the telemedicine doctors or your doctor. Volumes are, now think about it, all of the people who normally would go to the hospital, so most intermediate urgent care type settings, are not as crowded as you might imagine. Why? Because most people don't want to go there because they're afraid that they're going to be in contact with people who might be infectious. And that is a good and healthy fear. It is why we're social isolating. It's why we're staying home. Okay, so that makes sense. And so those people then go home and they're getting into calling the multiple telemedicine companies. I work with one of the bigger ones. And so we constantly, I start taking patients at 4 a.m. To give you an idea of me, I'm not working in the front lines in the sense of like talking to patients and touching them. I'm protected. And so I've been talking to some friends on the ground and I sort of get a feel for how things are going. The ER folks, I mean, this is really what we live for. Like in a way it's horrible, but it's also like, it's exciting. And this is what we've been trained to do. And so the ER people are all in, the ICU people are all in, the infectious disease people. I mean, the doctors in the hospitals are working, 200% of what they usually do in order to be ahead of the curve. And sort of like Dr. Fauci says, like if you haven't thought about it before it happens, you're already behind. And so all of that is happening on the ground. And so I'm the person though that people are calling. So we have on average 1,800 to 2,000 patients waiting in my waiting room right now on average 24/7. Okay, that's crazy. And so, you've got, I don't know, 50, 60, 80, 100 doctors running the telemedicine lines. Think about it. And so people have been, so my perspective from that has been amazing. Now, the bulk of patients who might have corona-like symptoms are calling the line and waiting. And the bulk of them we don't send in. In fact, a very small percent of people that I've spoken with, I've had to send into the hospital. A lot of what I'm doing over the phone is going through the symptoms and then having an intelligent conversation with people who are extremely kind, extremely patient, extremely understanding. I am floored by how people have responded, at least in the sphere of telemedicine services, of understanding. And I've seen the change in a week of people who had no idea. And my conversations with people used to take like 20 minutes, which that is long for me. And now I'm having 10-minute or 8-minute conversations because people have context. They understand. In fact, I had a very interesting conversation yesterday with a woman who has baseline lung disease. And she, I think, used to be a nurse. She's a little older. She measured her oxygen levels, so she knew enough to do that. And she was like at 90%, short of breath. And it was evident that she had fever. So it was evident she was going to have to go to the ER. And honestly, I forgot to tell her. I didn't even think about it. There are things that you have a lot to cover with people that and she said to me, well, I guess she said to me, I think I'm healthy enough to drive myself to the ER. And it was like oh my goodness, I hadn't even thought about that. And so I asked my friends on the ground. And so in fact, at the hospitals, if you are seen in that tent where you are a high risk coronavirus potential, no guests are allowed there. So you don't get to go with family members. You get to go alone. And if you get admitted to the hospital, you're admitted alone, which makes it a tension. A lot of people don't want to go because they want to be with their loved ones. And so really it pays to stay home unless you're really sick and to go through the wait. And people are waiting 8 to 12 hours to talk to a doctor right now, and honestly, and they're not complaining because they get to at least talk to somebody in the safety of their home. And we can go through the symptoms and remind people that 81% of people who have coronavirus will not end up having to go to the emergency room, will not have to expose others to the illness, and will get better. Okay, this is incredible. All right. So I will come back to that. So let's put that in a box because many of you might have more questions about that. Let me also remind you of something else. In a week since we did the last live, there's still no treatment for coronavirus, okay, for COVID-19. There's no treatment. And I know everybody understands that, but I think this is an important reminder as it pertains to testing. So if you're not that sick, for instance, a week ago, we were asking people how we would suspect somebody had COVID. We would say, okay, have you been to one of the 5 big bad countries? Italy, Korea, China, Japan, Iran. And they were like, no. Okay, were you in contact with someone who had COVID? No. Well, now, a week later, that is no longer really, I mean, it seems irrelevant to ask because we have corona here. We've got 19,000 patients in the United States who have been tested positive. That's without the ones who haven't. And so many famous people are now doing videos. We were positive. You know, it's no longer just Tom Hanks. Last time I said Tom Cruise, I apologize, but Tom Hanks, and it's not just him, it's many people now, and you're hearing those cases again and again, and most are doing, by God's grace and thankfully, really well. And I think this is important because when people are in this frenzy of why aren't we testing, on one hand, sure, I understand it. On the other hand, you now are in a state where you have to assume that if you've got some level of fever and cough, and maybe even a little bit of chest discomfort, if you've got a lot of it, the doctor that you speak with is going to be smart enough to send you in. But if your symptoms are mild, you're going to be managed at home with, again, the same treatment that you would get if you were in the hospital, because there's no treatment for it. So who gets in the hospital? People who are in respiratory distress and whose disease in the lungs have become significant enough to require a ventilator or to be in the hospital on oxygen and require more aggressive treatment. And we've talked about this before. It's people who have chronic, well, the over 65 by and large, although a couple of days ago we heard that there's a lot of people hospitalized who are under 65. It's also the people who are sickly, meaning asthmatics, diabetics, immunocompromised. The list, is available all over the internet. And many of you have sent me emails. I have this, I have that, and I've been able to kind of guide and help some of you. If you have questions, feel free to send me those emails. Those are quick answers we can send back, and a lot of reassurance, really a lot of reassurance in this scenarios that I'm getting, that I'm talking to people about, which is great. So again, would it be awesome to have testing for every human? Sure. Is it realistic? No. Cost-wise, test-wise, there's not enough tests. And so often those tests are saved for people who are sicker, or people who are healthcare professionals, or people who, and on and on. There are decisions that need to be made, and those decisions you have to trust need to be made at the level of physicians, and of course the government, the local governments. In Illinois, for instance, the IDPH has a big weight in that, but there's a lot of labs that are creating now tests and different ways to assess those things. Now, I want to we'll leave the testing for a minute. Testing is by and large much better now than it was a week ago, and will continue to improve. So I'll leave it at that. I don't think we want to talk too much more about that. Until we take questions in a minute. I just want to sort of run through and cover some of your questions that have come up. Many of you have asked, how's it spread? Again, it's through spit, respiratory droplets. So it can happen. I'm spit when I talk because I'm intense, and so this area, if I had COVID, would be basically infectious. How long do the droplets last? Don't know. A lot of uncertainty in this COVID business. Maybe a couple of days. And so one of the questions that has come up has been about takeout food. Do we eat takeout food? I'm going to hit it now. We're not going to wait because many of you tuned in for that. Should I order my Uber Eats? I want matar paneer. I want Indian food now. It's like my comfort food. And what am I going to do? I'm going to order. That's what my favorite food is on Uber Eats. It's what I always order. And so you have to make a decision. You don't know who's cooking it, all right? You don't know when they cooked it, and you don't know if the container has been covered with a cloth or not. So there's a lot of uncertainty. I personally have quit ordering Uber Eats. Now, I know many of you are small business supporters, and you're stressed about it. What are they gonna do? And everyone right now is not working in their homes. Everyone is going through this. This is economically a disaster. Make your decision that is best for your family. If you're living with someone who has asthma, don't order out. You don't know how they did that, and who prepared it, and what the Uber driver who brought it to you had sickness or not. We don't know. And if you don't care, then order it. And if you get sick, don't just rush to the ER. Call your telemedicine doctor and accept that you might not get tested, and accept that there's no treatment, and accept that you might die. Do you see? So we're intelligent people. We're given choices. And so me, myself, and I am eating a lot of string cheese lately. I don't have time to cook. And I have, back when you're shopping in the grocery store, and you always grab those extra tins of tuna. I've got 6 of them now in the container, because I thought, well, I can always eat tuna. This would be a great time to eat tuna salad. Why not, right? I mean, you got eat foods that are safe for now. You're that's so high in salt. We don't do that. We can do a Q&A about that after. And so I wanted to just talk a little bit about that. Another question about the spread, because remember, it's spread through spit. So people are saying, what about, does it hold on paper? So I've been, your mailman coughs a little. You don't know if he has it. He could be an asymptomatic carrier, or she could be an asymptomatic carrier. You go get your mail. It's a good question. If you sit and analyze everything right now, then I would advise you, it's not a bad question, especially if you are immunocompromised. Put a little hand sanitizer on or wash your hands are good. Open your mail, look at it, and then go back and wash your hands after. That's the point of why people stood in line and sold out of hand sanitizer. Those are the reasons to use it. You see, this is the concept. Is if you've got somebody who now is, maybe not sick enough to go to the hospital, but might have those symptoms of corona. So what are you going to do? You're living in a house with other people. You might not be single like me. I got no one to infect. I don't even have a cat. But if you're living with people and you're worried about them, you're going to isolate a room in your house. That's the sick room. Truth is, by the time you have this possibility of COVID, people in your house have been infected. But that's the idea, is they've already been around it because you didn't know when you got it. And so use your judgment. It's like back in the day we had chicken pox. And so there's certain quarantines that you do. And so someone has to take care of a child who might have it. Somebody might have to take care of a spouse who might have it, but make sure it's the one person, and wear a mask and wash your hands when you come in and do the logical things that you would do. Ask the person to stay in the room. It's more concerning and worrisome if there's elderly people in the home. I think that's the population that is of concern. But so we don't know how long the virus can last on the surface, but it's spread through spit. Today, the more you read, the more you'll find out. And then sometimes it's like, okay, I don't need to know that much. But now there's theories that it might be spread through fecal route as well. And so wash your hands after you go to the bathroom. In fact, somebody asked about that. There's some data now that suggests could people who have COVID also have diarrhea? They're seeing potentially that. Here's what I want to say to all of these details. You guys don't stop worrying about all of these details. That's the point of talking to your doctor or calling a teledoctor, or even going, if you're not sure, going to that intermediate care. If you're not that sick and you show up and they take your temperature outside, preferably you're going to make a phone call first. That's the idea. But say you didn't know. No one's going to bang you on the head and be like, oh my gosh, I can't believe you showed up here. No, people in the hospitals are kind and they understand the tensions. They just want you to work in trust of what they are trying to tease out and figure out. And so you might have diarrhea. Now, if it's in the news, what happens, what I've noticed, everybody's like, oh my gosh, diarrhea is a part of it. I had diarrhea last night. But you might have ordered that Uber Eats, you see? So people are panicked over every little symptom. Here's another example, ibuprofen. There's an article or a few data that says maybe if you have the coronavirus, you should not take ibuprofen because it causes more harm than good. Now everyone's like, but I took an Advil. I had my period last week. I took an Advil. You're not going to die if you took the Advil. It's just that once you know you have COVID, if in the 3 weeks that we've had this disease, they've seen patterns, then if you've got an option of Tylenol, choose it over ibuprofen. I've always been biased to ibuprofen. Frankly, nobody pays me for either or, but you see, don't get emotional about it. Ask questions. That's why I'm doing these things, is to try to answer the questions and I try to respond to as many emails as I can. But remember, I'm seeing 100 patients a day. And so it's a balance of what we can do, but also understanding that there are real fears. And most 99.9% of the people that I've answered have been like, literally, I'm not even like a polite email answer. They're like, do we get, and I'm like, no, yes, like one word answers. And I think people appreciate that they're just getting an answer because it's just a matter of knowing. And so don't panic if you took ibuprofen, but if you have symptoms that include cough and fever, you might want to choose Tylenol instead for now, until we know, because no one knows for sure. Another one came up, steroids. There's data that suggests that if you are sick in the hospital with COVID, you're intubated, you're on a vent, you're really bad, that if you take the steroids are not helpful. All right? So now today I had a conversation with a mom who hopefully is listening. And she said, well, my kid has croup and I'm a little worried if it gets bad. And I said, well, don't stress it. He sounds very stable. Just watch him. And then you can always do a telemedicine call because you might be able to get some prednisone. She said, oh, but what if he has COVID? It would make him worse. I think you're overthinking it. I think, first of all, you can't just go to the pharmacy and get a medicine like prednisone. So you would have to have a conversation with your doctor, who would hopefully be able to detect if there's really croup symptoms, or if you're an asthmatic and you've got an exacerbation and you need a steroid. You see, there's reason to use those things. You're going to get them because they're going to help you. Because even though we're focusing on COVID, all of the other illnesses that we've had in the United States in March are still there, including the flu, including bronchitis, including allergies. Think about that. And so now we've got all of these things going on. So let your doctor, who's paid to do this, who has trained to do this, who is wrestling with these things and reading and trying to make the right decision for you and helping navigate the road for you, allow them to help you make that decision. I really promise we're doing our best to do that. And the difference now, if you get into the hospital and you're sick, you're probably not going to get steroids. Do you see? You're not going to die if you took a course of steroids and then you get sick and they tell you it's COVID. I just want to just remove that alarm. You're going to hear a lot of different things. Same, we're going to talk about the anti-malarials. A lot of questions about that. Oh my goodness, does that heal? I got an email from a very wonderful missionary that I've never met before. They're down in South America somewhere, and they're in an orphanage, and they're like, hey, and we also, they asked me about some things about quarantining, and they said, what about this anti-malaria things? Like, they have a lot of it down there, right? This is common medicine for them. And I'm like, in my head, I'm also thinking like, look, we're 3 weeks into a disease. Like, let the research come, let it grow. And all these scientists that are way more intelligent than I am are working night and day on this, that they even have theories on it is amazing to me. And when it does, like, say tomorrow they go, yes, indeed, we found that it works. You're not going to be able to like call the teledoc and be like, I want an anti-malarial. It doesn't work this way. It will be saved to certain populations who are sicker. Do you see? And so you have to also allow that. And that's besides the fact that they're rushing because now we're saying, okay, maybe it could save lives. And so when you hear about that President Trump is possibly going to expedite something to go through, it hasn't even been tested yet. You see, now you got to test it. And then after that, in a year or two, it might be available. And so let science do what science does. I think this is important. And it's not like then you can be like, well, like people will do this now. Very few, honestly, but there are a few people who, my friends in the ER have said, like, they'll be like, I'm not leaving the ER unless you test me for COVID. It doesn't work this way. Like, you can't. Like, there's process and there's procedures and there's a need and sometimes there isn't. So it's a very small amount of people who do that. By the way, I'll tell you a funny story. Like, people ask me all the time, like, what kind of stuff are you seeing on the phone? All kinds. I see a lot of run-of-the-mill stuff that we used to see before. People who need care, UTIs, sore throats, rashes, poison ivy, you name it, small things, big things, medication refills, people run out of their insulin, their doctors are not open, they can't go get it. Simple stuff to complicated stuff, to long conversations about flu and bronchitis and cough and allergies and all those things that make it a little bit hard to navigate and take a little bit more time. But today, I'll tell you something funny. Picked up a patient, I was tired. Last patient, I thought, I'm gonna take an easy one. It was a medication refill. I was like, phew. I'm done. I'm really like, it's been a long week, I'll tell you that. And we still got a long ways to go. And I'm going to actually move into the last bit here in a second and then take more questions. And I got this call and I picked it up and I opened the chart. And guess what the guy wanted? He has thinning hair and wants Rogaine. And I was like, you have got to be kidding me. We are in the middle of a pandemic and he waited like 560 minutes to get Rogaine, and we don't even give it on the platform. Even on top of it, I had to be like, this company does not give that. We don't do that in my company. And I was like, and then I was like apologizing to him, like, I'm so sorry. It's not something we do. You might want to like Google other services or go see your doctor. And I'm like going, how do we wake up and go, the world is shut down. I'm gonna just call in for hair meds. Like, you know what I mean? Like, my sister's here. She's going to read me some questions in a minute. And I just thought it was funny. And so 1 out of thousands, but by and large, kind, reasonable, intelligent people who long to get good answers and just want to do the right thing. So, I wanted to move. Last thing, I had another thought. What am I forgetting? Are questions starting to come up, Diana? I'm coming towards the end here. Oh, supplies. I want to talk a little bit about supplies. That's a lot of questions came in. Doctors have been, and ads on TV and the news has been talking about the fact that face masks are few and far between. And that is a need. They're not few and far between, but they're running out of them quickly because the volumes are high because before you would put a mask only in like, the N95 or the protective gear would last you for 6 months. Now they're lasting for 3 months. Basically it's volume related. And so there is a big need. And so the CDC a couple of days ago made the suggestions that doctors can do scarves or homemade masks. And so someone asked me about that. You're going to need to make millions. So if your talent is to make those things, start working on them. I Googled it and there are parameters to how those would be. So if you're into that, I think, there would be a need. There will be a need for that. Oh, I know what the last thing I was going to hit up, and then I'm going to open up for questions that I haven't covered. Now, I hope I've covered a lot of the things that have come through the questions, but the last is this quarantine, this whatever we call it, social isolation, physical distancing, I think is the newest politically correct term. We're not social distancing because we want to be social people. Every human, have you noticed, is like doing their own TV channel. It's completely entertaining. Like, I had this disastrous thought the other day. I thought, what would happen if the Wi-Fi was taken out in our world right now? We would die. Like, what if we had no phone access? We would literally die. Like, we are so blessed. Like, at least if this is going to happen, it might as well happen in 2020 when we can get on this and do this. And so I am deeply grateful. I'm going to tell you that. But so we started off, the idea was we're home till March 31st, and then people were kind of frustrated. And then now our lockdown in Chicago, and our numbers are not like California's yet, or New York's or Washington's. The states are Washington or New York has beat up Washington. I think, I don't know. It's not a race we want to win. And so Chicago, we're now on lockdown till, get this, April 7th. All right. Most doctors will tell you, conservatively, we're going to have to get ready for a marathon. We're going to have to get ready for the long haul. I don't know what that means. I'm not into, it's like predicting when Jesus is going to come back. Like, nobody can predict it. We don't know. Oh, there's one other thing. We're going to talk about, we're going to talk about immunity in a second, and then I'm done. But talking about timelines, I want to really, and there's a couple hundred people watching right now. I hope many will watch later. I really want to try to put this seed in your head and this preparation. I think this needs preparation. We're running a marathon here. This is not a sprint. All right. When President Trump said, and I know there's people always critiquing, like, I get that. But the truth is, when mention of July and August are thrown into the news, I think the reality is that we have to psychologically prepare for that possibility. Doesn't mean you can't leave your house. I mean, you can go get supplies. But I think this idea of being distanced from people could go on till the summer. I really do. I really believe it. I think before the end of April, this will be our new normal. I don't see how before April is over, this will change. I could be wrong. And if I'm wrong, you come back and say you were wrong, and I will rejoice. I believe Jesus could heal us all. I do. I am 100% doctor and 100% miracle. Like, I think God could change it now. I have zero concern about that. I have taught about God bringing fire from the sky. I believe in a Jesus who rose from the dead. So I believe in miracles. I believe God is alive. He sees this. He's in control. He knows what's happening and could heal us. But the reality is that if continues the pace that we're on, we are going to be home for a while. So get ready. I had a rough day today. I didn't sleep well last night. I worked really hard today. I did an event last night online, and I had this coming today, and I really like to prepare a little bit for it. And my head, and I know I'm going to sleep like a baby tonight. All this to say I was cranky, and I got in a fight with my sister, and we're a week into it, and I never fight with her, and I'm like, blah. We're all going to go through that. It's normal. And so someone asked about faith and fear, and this is, I mean, if you're a person who has no, of non-faith, or, sort of a nun, and you're trying to live your life, I don't know what you're doing. Maybe you're drinking a lot of alcohol right now. Maybe you're smoking a lot of pot. I really don't know. I just know maybe you're just meditating and doing yoga. But if you're a person of faith, like I am, we believe in prayer. We believe that these crises grow us and they stretch us. And yeah, we're going to be tired. Expect it. We're going to go through. I was even thinking today, okay, say we're social isolating till April, May. How are we going to reintegrate? Like, who's going to go to a big conference? Like, think about it. All of the ways that our lives are going to change. And so let's start praying and thinking and preparing for our new normal to a certain extent. Not that we're going to be locked in from now till eternity. No, we're gonna find it's going to pass. Every infection passes. The summer, there's theories. There's so many theories about everything, and there's not any proof. But maybe the heat will help to remove the virus eventually. We don't know. And then the big question that comes up, and that's the last point, is what happens after? And so do we get it again? And I used to answer, oh yeah, we do, but it's different again. So you're going to go through the season of COVID, and there's a lot of theories. Some say maybe there's herd immunity if enough people in the United States get it. And again, most will be asymptomatic, most will be home, most will not know they have it. And but if there's enough who get it, then we will have, by herd immunity, protection. And again, the goal is within the year to have a vaccine. And I really believe that we have the scientific genius in the world that is currently working on this, and it will be available. I really believe that. I have no doubt. It'll take a little time, and so we're going to have to give people time. But I don't know if the herd immunity theory is right. We don't know because we've never walked here before. We know that if you get it once, you have some level of protection. How long? We don't know. So even you heard the news about China, they have no new cases or one new case. What does that look like in 6 months? We don't know. Which is what I'm going to end with a verse and then take questions because I think this is just huge. I read this overnight. I woke up, I couldn't sleep. Here's Isaiah 42, verse 16. And if you aren't a person of faith, again, I just listen because the word of God is so inspirational in many ways. And here's what God writes. And I will lead the blind in a way they do not know, in paths that they have not known, I will guide them. I will turn the darkness before them into light, the rough places into level ground. These are the things I do, and I do not forsake them. All right? That's God's word in Isaiah 42, verse 16. You got to write that down, read it, meditate on it, because that's ultimately our hope is, yeah, we're walking in a dark tunnel right now. Psalm 23 is a sort of more famous version of it. When you walk through the valley of shadow of death, I mean, it's a hard season. Everything is changing. But there's an end, and there's a Savior named Jesus who's walking before us who has this under control somehow. We're going to come through it. I've seen people of faith pray, get on their knees. I saw a prayer meeting happen with multiple leaders on a Zoom call on my friend Jamie Ivy's Instagram today, and just a lot happening of people showing up on their faces to God and saying, God, we believe you can do something here. Does that mean science doesn't exist? No, we believe in both. You go to the doctor if you're sick. There's meds to use if you're sick, but we also pray like crazy. That's my belief. And that's what I'm doing. That's my plan. I'm working 10, 12 hours a day, but I'm also praying. And maybe not enough, but as much as I can. And people are praying for me. And somebody asked, how do you pray for doctors? Right now, doctors, it's like surreal mode. You know, you're sort of in this, just this crazy, you know, it's like everyone's on adrenaline, but you wait a week or two. And so right now, the stress, I mean, infections are still low numbers. The deaths, nobody famous has died yet. Oh, pray to God, nobody does. My point is, it's still out there for many people, unless it's a family that's been affected by it. In fact, that speaks to the 20-somethings who still want to hang out with their friends. I had a mom say, how do you tell them? And honestly, like the beach scenes in Miami, and my thought was, are these people stupid? No, they're not stupid. Really, it's sort of a crass way of looking at it, and I was guilty of it. But really, it's that it hasn't hit home yet. It's like it's out there. It's like people who party, and you know that they could get a drug overdose because you've seen it in the ER, but they don't care because it hasn't happened to them yet. And hopefully, the generation of 18 to 30-year-olds are waking up. This is why the government has to do lockdowns, because some are not. And for the protection of everybody, they have to take these severe measures, which is, by the way, why China was able to overcome it in 55, 60 days, whatever it is. Whereas Italy's numbers are god-awful. They're like 627 deaths in the last 24 hours, like crazy, because they weren't as strict. And people still wanted to go out because they're social people, and they were a little bit late in doing social isolation. So still believing in social isolation, still believing in connecting in every way and answering your questions, still believing in love and kindness. And yeah, you get in fights, but then you go back and say, you know what, I was wrong, please forgive me. And you fight for what's right, and we come out of this better and stronger and closer to our God and Father, Jesus Christ. And so let me take some questions that I haven't addressed yet. Many of you are putting in comments. I have my sister here to read. Have I missed anything big? I felt like I tried to go through most things.
So people have very specific questions about immunosuppressive cases. Like, I'll ask you, hyperthyroid, yes, no.
Okay, like if
controlled.
So
MS.
hang on. I can't answer so quick. Right. So in general, you know yourself. If you've got an immunosuppressed condition where you've had to be on steroids or on methotrexate or on Plaquenil, so rheumatoid arthritis, those categories, not thyroid. Thyroid I don't think of as an immune deficient. You know, that's not a heart diabetes. Yes, thyroid no. But because if you're prone to sickness, then you're going to be more cautious. So again, what does it mean that you're more at risk? It just means you've got to isolate even more carefully, right? I mean, that's it. And then you take it in stride. And remember, if you're watching, by the way, if you don't know the Lord and you're watching, that's the only way I get through it. Honestly, that is the only way I've survived 20 years of a career in pediatric ER, is because I trust that there's a God who is bigger than all of this. And somehow he will work out redemption through pain. I really believe that. And so I lean on that. And I think if you are sickly, whatever you want to call that, Trust that God has a plan. Do your part. Don't order that Uber Eats, for goodness sakes. But trust that He's going to protect you if you get it. And you might have it, and I might have it. I don't think I do, but you never know. You never know. And so I'm not going to get a swab if I have it right now. If I'm like this, I could be asymptomatic. I was on a plane on Friday. Like, we don't know. And so, and that's okay. We don't have to know everything.
What are some of the first symptoms?
I think the triad, again, I'd go back to say fever, cough, shortness of breath. Now, this is where I get calls now regularly of people who are super honest, super awesome, and they're willing to wait 10 hours because they just want to hear it. So they'll call me and be like, I just have sore throat, but I feel a little tight in the chest. And it's clear they're not, right? They're just scared. And I go through the list and I ask them, and I can tell in conversing with them that they're not a corona risk. But again, you can't say 100% because we're not testing them. And so you make decisions based on symptoms. But the triad is fever, or let's say over 100, cough, and shortness of breath. Those are the big three. If you have those big three, you need to call a doctor. Absolutely call a doctor and let them help you wrestle through the nuances. For every call that I get that's sore throat, allergies, I also get one that has symptoms that now I think, this could be. And so what do you need to do? 14 days at home, and then you let us know if you're worse, or if you can't breathe, you go to the ER. You see, so there's a system there's now protocols and ways to think about things, even in 1 week. So imagine how, if we do this live next Friday, how much more information we're going to have. And we're going to be able to cross that bridge, and we'll do it one day at a time. We'll do it by God's grace. We'll do it as a community. You notice how we're all the community fighting one common enemy right now. And by God's grace, again, we're going to see miracles happen. I really, really believe that. You pray for them, you look for them, you be patient with one another, and you just wait on God and see how this is all going to play out. We're going to go back to normal someday, hopefully soon, but until then, we're going to become better because of it. Another question.
How do we access telemedicine?
So there's a lot of platforms. Mine is mdlive.com, and you just literally go to them. You can Google teledoctor, and then you just sign on, and your insurance company is covering it. And if you even before COVID, the nice thing about them is you could pay out of pocket, and it was affordable compared to going into the doctor. So I don't know what your insurance plans, but there is everybody basically covers them. If you're a Medishare patient, it's covered. There's just a lot of plans, and it's very affordable. And yeah, you might have to wait. I will warn you. And they have a sign on there, and we can't order testing for COVID. There's certain things that we want patients to know. But you could think about it. You could try to go to the hospital and be exposed to illness, or try to be frustrated if you can't get in where you want to go, or you can be in your bed in the middle of the night and then get a call 12 hours later or 10 hours later, or hopefully 6 hours later. During the day, our waits are faster because there's more doctors working. And so the 4 o'clock calls I take are brutal because people finally fall asleep, and I'm like, hey, I'm here. And so people have been so gracious, though. I'm just really, really moved by that. And so you can get on and take a call. And again, don't call if you have nothing wrong. Don't call just because you're like, oh, I have a random question. If you have a random question, email me. Do that. If you're like, well, my aunt, Myrtle has a rash and I was around her and then she coughed, and then email me. Don't do a call for that. But if you're sick, call us.
Are digestive problems a symptom?
Well, I mentioned that earlier in the conversation. You're going to hear a lot of studies. They're going to look at data. And so now they're saying that, they're seeing some diarrhea with COVID, but it's not the trifecta, that three, fever, cough, shortness of breath. So again, don't panic if you have diarrhea. But if you start being sick, feeling sick, having fever, chills, call that line or call your doctor. Your doctors also are still working. They're just being very cautious about who they see in the office, because what they don't want is 50 people show up to the office who might be carriers, and now they're patients who are maybe compromised or are exposed to that. So that's why they're often telling you, hey, you need to either call the COVID hotline or call telemedicine. And so this is how it's working right now. And think of it. 5 years ago, there was no telemedicine. Think about the timing of things and how God uses these things for good. It's pretty incredible when you really break it down and think about all of these details that we take for granted.
Do kids have the same symptoms?
We didn't talk about kids. That's a great question. So under a year, higher risk. Any infection is going to be high risk if you're under 1 year of age. That doesn't mean you can't fight it. It just means you're going to be a little bit more focused in the care. So if I get a person under a year anyway without COVID who has fever and cough, I'm going to be more concerned about them. And so, but by and large, the pediatric population has done better. Okay. up to 18, because yesterday in the news, you remember 20 to 65, like have some hospitalizations, but the pediatric under 18 have done better. The numbers are lower. I think in the Seattle ICU a few days ago, my friend told me they only had 4 who were really sick. So it's a good thing for kids, which is a blessing from the Lord. So we're really grateful for that. And remember, again, as we're sitting and thinking and worrying, there are people like, look at Dr. Fauci, who's become really sort of an American hero, I think. This guy, I mean, his team, I mean, they've done some great science already. I mean, think about where HIV and AIDS has come in the course of the last 20 years, right? There was a time when it first became known, nobody wanted to touch people with HIV. Remember? It was awful. And then now it's like, there are people who've been cured of it. And it's because of work like people like Dr. Fauci who's done the work. And so trust that there are people at all levels of science who are doing work to try to get us answers. And I'm telling you, they're smart, they're dedicated, they're working 300% extra than they were before, and they were already hardworking. And many of them aren't even getting paid a lot for it. And so just those, that's where your prayers, focus your prayers on the sick. Okay, focus your prayers on those who are actually sick and hurting. I think because there really is that high fatality rate is higher than any other illness that we have, basically, and it's brutal when it's bad. So pray for the sick and their families. Pray for healthcare workers and the needs there, because they're on the front lines and they're exposed to this and they're afraid, but they're hiding it because they're excited now about the work, but they're going to be tired. And then pray for the scientists who are doing the work, and then pray for the government to make wise decisions, both at the state level, but also the federal level. And then pray for families who are going through the usual, stresses that we're feeling, the financial stresses, the relational stresses. People are joking, like, we're going to see a lot of like November babies. And I'm like, I don't know, man. I hope we don't see a lot of divorces. Because I mean, if I were married, I'd be like, I'm out. Like, I'm going to sleep in the garage, right? And go for a walk. People asked about that too. Can you go outside for a walk? Yeah, but just don't go in groups. Now we're on lockdown, though. I hold that. Still go on. Yeah. Sorry, my sister knows that. She's a physical therapist, and she's into health a lot. In fact, she has some great, that brings up a great point. Get an exercise routine. You don't need a treadmill in your house to get into an exercise routine with your family. She's taken her 2 boys, they're high schoolers, and now she uses them to demonstrate the exercises that her patients who are keeping up with their physical therapy needs are doing. So there's a lot of ways to be fit in a small space. Like, you don't need a big space.
6 feet apart.
6 feet apart. Right.
Or 3.
Yes. Anyway, the point is exercise regularly, read your Bibles and pray regularly. Gather through this medium with people you love regularly. We're not cut off from people. We have so many ways to discuss with people. And if you're an introvert like me, you're just like, good. No, I'm not feeling guilty about being
fever below 100, should they be concerned?
Yeah, I mean,
99.5.
99 is a low-grade fever. I'm not usually worried about it. No, the quick answer is no. Masks work well enough, and so if you have, like, I like them in the context of if you think somebody could, like, if you're taking care of your husband or your wife or your significant other or your child, and they have some level of fever and cough and they're not tested, but they might have COVID, you better wear a mask. So yeah, I would say they work in that setting, even though they won't work great. Somebody's got to wear a mask. And so better to wear it than to not. But if nobody's sick in the house, don't wear a mask.
How do we explain to teenagers that they cannot have few friends over or go to their house?
Well, it's the same way the government is explaining to, honestly, I think at this point, the same way the government is explaining to us, which is we're on lockdown. Like, I don't think I can go to a restaurant now, right? It's not an option. So I think parents, yeah, they're going to be mad at you, but this is not, I don't think we're anymore. A week ago, it was a battle. Now it's not a battle in my mind. You can't go to your friend's house. That's just nonsense. Like, I'm being serious too. I'm not being, I know it's going to create some tension, but it's not an option. You can't hang out at people's houses. Their parents don't want them over, and you don't want the kids over. I mean, it's just not a good thing right now.
And now in the parks, if they see the kids...
Yeah, if you see people in the parks playing together as kids, that's a problem. So if you go outside for fresh air, like, I think if you have a chair, the weather's going to be nice in Chicago. I don't think anybody's going to arrest me for sitting on my deck, but just be logical, right? And send me an email if you're not sure. I'll tell you the truth.
Do I need to worry about groceries that I bring into the house? Do I need to disinfect the packages?
Yeah, a lot of stuff on the news addresses that. My overall, I'm a pragmatic person, right? I mean... I'm not making confession to you. Like, I have, on occasion, used the bathroom and forgot to wash my hands. All right? I mean, I'm sorry. Like, you might have now lost all credibility of this video. Sorry. But it's the truth. Like, who hasn't done that, right? I've at times coughed without, and maybe they would survive. Like, you know, like, so I don't know. If you're really nervous, if you've got someone who's over 65, wash them. My mom doesn't put a thing in her fridge without washing it. I bring the apples and I throw them in the fridge, and then I wipe it a little. So my immunity is really strong. I never get sick. Now, in coronavirus day, you're going to turn this up a notch. My sister's like, what's she saying? But rinse them in water. How hard is this? We got nothing to do. We're home all day. So take the effort and don't ask the questions. Stop stressing about it. Do what you need to do. So yeah, worry a little, but then answer the solution. Wash them and put them in the fridge. What else?
When you have allergies and sneeze, people give you a dirty look and you have to army crawl out of the grocery store. Can you bring that up?
Yeah, I can. That's a good point. This is why when people call me and they have colds, I'm keeping them home until the cough is gone. I wouldn't do that in normal days. There's like disaster medicine and there's normal medicine. We are in disaster medicine. There are things I do now within reason. So especially about going into school, into work, that I'm just stricter, all right? And some of it is we are living in global anxiety. You don't need to add to it. If you're sick, don't go to work. Your doctor, I guarantee you, I'm going to give you a note for work for 2 or 3, 72 hours, whatever it is that takes until your cough is gone. You should not be at work coughing. Now, you're a single mom. You got to go to the store. You got to buy the groceries. You know, people look at me funny all the time. Do this. Even my nephew knows. You know, if you have to sneeze, you have to sneeze. Like, I mean, I pray that they won't mob you. And you know, I don't have a great answer other than be kind to one another, and separate 6 feet apart. You shouldn't be grocery shopping like shoulder to shoulder. And then at this point of the game, guys, we're at the point now where you should not be going grocery shopping more than once a week. You really shouldn't. So if you haven't yet, if you're like, I'm up every 2 days, you need to go tomorrow and finish up. Like, and I know, let me address this. You might be listening going, well, fine for you. You got a nice brick wall behind you. You know, we can barely afford it. Listen, I see this on Twitter all the time. There are people who are saying to people, look, if you can't afford your food, tell us. If you're watching this and you're like, we are really in trouble, we cannot afford a meal, email me. Well, I'll figure it out. We'll start a fund of people who can put money in it so we can get you groceries. Like, it is fixable, all right? So you should not be going, well, I only have $10. I got to go to the grocery store on Monday because I got to go back on Wednesday. This is not the time to do it. I can buy you foods that will last you. I really would lovingly do it that would last you for some time. That is not very expensive. Just don't go to the store more than once a week. Minimize, be home. It means get to know your family members. It means inevitably you might get in an argument. And then you're going to have to fix it. And that's okay. That's not bad. We can do this. What else?
If I, as a single person who is self-isolating, why do I constantly need to wipe down surfaces in my home?
You don't need to. I mean, if you're saying, I mean, again, like if I'm home alone, I'm not wiping things down all the time. I mean, if I spill something, I do. But I'm not sick, and so no. You can. I mean, it depends. If you're super hyper and it makes you feel better, wipe it down. But be slow on those Clorox wipes because we're gonna be in this for a while. Remember, it's a marathon. So yesterday I finished a roll of toilet paper, and honestly, for a second I was like, what am I gonna do now? Like I was like, I'm one down, it's been a week. And so I'm trying to go smaller, it's like, it's hard. And so this is funny. I mean, keep your humor about it because it is kind of funny. And tell your friends those stories. Like the memes that have come up, like that one Karen, get rid of the sign, gather, like, it's hilarious, So, I mean, you gotta just keep a good spirit about it. And that's how ER doctors make it, and nurses and staff. They laugh about things that you can laugh about. And then they cry about things that you need to cry about. And many of you, by the way, on a serious note, many of you will go through some mourning and lament and it's healthy. Why not? I am on the treadmill sometimes and I'm seeing 100 patients a day and I'm on the treadmill and the tears will start coming down my eyes. I can't breathe. And that's normal. That's normal, and it's hard because you don't think about it, and then you're like all of a sudden the avalanche of what is happening in our world. And so let the tears come. There's no shame in that. Let it out, and let it heal you. Tears are healing. And remember, we're in this season of Lent right now. We are supposed to be feeling those things, the road to Calvary, the death of Christ, and then the resurrection. The timing of this is crazy. And so use the time, use those tears to draw you closer to God. And there's so many Psalms is a great place. If you don't read the Bible a lot, start in the Psalms and just, we've created a Facebook community. By the way, my site is livingwithpower.org. If you go there, you can join our community. I'm teaching weekly on how to make it through a crisis. Just dropped the first teaching yesterday. I'll be doing another one next week. And we're just going to create ways to encourage people. That's our heart. And this is why we're doing this. Nobody's paying me. I don't represent a company. I just genuinely believe that people are looking for answers. And so if this helps, great, share it with your friends. And if it's useless, delete it. There's so many, listen, there are people, but you can watch, it's like 1 million TV shows on the Facebook. Like, it's crazy. And so if you hate this, delete it and move on. My feelings will not be hurt. And if you love it, come back. We'll do more of them later. I'm doing these COVID updates, 2 to 3 minutes. I'm going to end this here soon. I think we've covered almost everything. If you want to email me, if you go to my website, livingwithpower.org, and click on the contact page, that's an email that comes to me. Or you can send me a direct message on Facebook or on Instagram, or you can put a comment. I'll do my best to answer as many. If I get emails, again, they're going to be brief. I'm not going to tell you my life story. I might even forget to ask you how you're doing, but I'm going to answer your question. That's about the capacity I have right now. Love you guys. Keep sending me the questions. Keep sending me their concerns. I did this today because a friend said, hey, it's time for you to do another Q&A. And so the questions you gave me were awesome. You guys are awesome. We can do this. Remember, let me read this. Oh, and let me pray it in closing. I will lead, this is God speaking. I will lead the blind in a way they do not know, in paths that they have not known. I will guide them. I will turn the darkness before them into light, the rough places into level ground. These are the things I do, and I do not forsake them. And so, God, we believe these words. We believe that you are alive and you have written this book for us to get encouragement in these valleys that we live through. God, make us people who see clearly even in the dark. Make us people of faith. Make us people who are unshaken. God, grow us in the ways that you've been trying to grow us, and help us to rejoice in the opportunities to serve one another, to love one another well. Be with all those things that we mentioned that are prayer requests. God, be with those who are hurting right now, who are worried right now. Bring your peace upon them. God, we thank you that you are a God who hears us, that if we wake up in the middle of the night afraid, you are there with us. And if we're having fun with the family and are laughing our heads off, there's nothing to be guilty about. We can rejoice that you give us precious moments of joy in the midst of the difficulties. So we thank you. We look to you for our salvation. We ask you to stop this disease, to heal us, to bring about a miraculous turnaround of events. But God, in the meantime, as we make our way towards that day, we ask that you would strengthen our souls for the glory of King Jesus, in whose name I pray, amen. All right, guys. Love you guys. I'll see you again sometime soon, and hang in there. We can do this.